I'm going to hit share on my screen. You able to see my screen now?
Yes.
Perfect. And then it should go into slideshow mode there. Awesome. Well, thank you all for coming. Appreciate everyone taking the time in the busy week here to take a few minutes to talk with me about knees. It's one of my favorite things, knees and hips. I'll take any chance I can get to talk to anyone about knee and hip surgery and recovery. We'll keep it pretty informal. If anyone has any questions or concerns, either feel free to stop me, or I think Elena and Bo, if y'all want to man the chat room, I'm happy to answer questions at the end if it's easier for you just to write them down. Like I said, I'll keep it light and informal and try and tell you all a little bit about rapid recovery from knee replacement. My name is Joseph Niland, and I'll be giving this talk this evening. So just a little bit about what we're going to talk about. I'll introduce myself, my background, and why this is of interest to me and hopefully of interest to you too. We'll talk about the quote unquote normal recovery process, maybe what you've seen some of your friends or family members go through, or maybe you've gone through already on another joint arthroplasty. We'll talk about some of the things that we can do before surgery to make sure that we're ready for surgery. We'll talk a little bit about the things that maybe your surgeon or medical team is doing during and right after the surgery. Then we'll talk about some of the things in the weeks to months after surgery that we can try and do to help ourselves along that recovery curve. And then finally, I'll give you a little bit, hopefully a peek behind the curtain of some things that might be coming down the road that you might see some friends or family have, or have doctors talk with you about in the coming months or years as new advancements are made. And then finally, we'll have a little bit of time at the end as well for question and answers. So a little bit about me. My name is Joseph Niland. I'm an orthopedic surgeon here at Columbia Orthopaedic Group. Originally from Central Texas, born and raised on a small ranch just north of San Antonio. Grew up with a bunch of siblings, had cows, chickens, turkeys, had llamas for a while, goats, sheep, pretty much anything that you could buy at the livestock yard. We had at least one of it at some point in time. After high school, I went up the road just a little bit to the University of Texas at Austin, where I got a Bachelor of Science in Human Biology. Was in the honors program there at the very end. I also ran varsity cross country and track, so as a Division I athlete, that's kind of how I fell in love with physiology and anatomy. Carried that over to medical school at the University of Texas at Houston at McGovern Medical School. Again, you'll see continuing that orange theme, the Longhorn theme. I stayed there as well for my orthopedic residency, trained at the busiest trauma center in the world. We had over 10,000 level 1 admissions a year, which meant that we were busier than Iraq and Afghanistan during the war there. It was just an amazing place to train. They had over 100,000 patient visits every year in the medical center, just a huge, great place to learn and absorb orthopedics. After that, I decided to continue my studies in Nashville at Southern Joint Replacement Institute. There I focused on hip and knee arthroplasty, complex acetabular or hip reconstruction, revision cases, people that were sent from all over the country to get help at this really cool institution to learn from. And then from there, migrated just a little bit north and west, and now here in Columbia, Missouri. So this is my overall patient care approach. I think it's important to have an idea of what your surgeon or what your physician, what their care philosophy is. Why are they wanting to help you? What is their overall goal for you? For me, it's to provide a comprehensive, holistic care to patients suffering from hip and knee joint disease to restore their mobility and help them achieve their lifestyle goals. Like I said, I'm a very active person. I enjoy running. I enjoy biking. I enjoy ultra marathons, which is running really long distances. And I don't ever want to give that up. And I don't think people want to give up their lifestyles either. So I figure that if I can help people do that, well, maybe I'll help myself in the future too. So I'll say a few caveats as we start to talk about recovery and post-surgery and ways to optimize. I think we have to realize that everyone's different. Everyone's not the same. Everyone comes in with their own prior history, maybe surgeries, maybe medical conditions. So I think that's where the comprehensive holistic approach has to come in. You have to have someone that's willing to sit down with you and say, how are you different from the person before you or after you? And how can we treat you in a way that'll help to optimize your outcomes? And then finally, I think a lot of people, whether they know it or they don't, they treat the doctor's office kind of as a used car lot. You know, when my family member comes to me and says, I have a problem, what do I do? Well, I say, you know, who have you seen before? What opinions have you got? And I think a lot of people, whether it's just for ease or for you know, inability to see multiple people, you kind of go to one person and you say, okay, that's the only opinion I need. But if you were going to go buy a used car, you wouldn't go to one car lot and say, well, I guess that's the best you can do. I guess I got to buy this beater in the front. No, you'd go to multiple car lots, you'd shop around, and well, I think our body is a lot more valuable than a used car. So I encourage people to have that same attitude, that treat your body like that, you know, luxury SUV or whatever, you know, professional athlete that you are. So just a little philosophies there. So let's start out by talking about and defining the normal recovery process. What does it mean to recover from a joint arthroplasty? So I think we first need to make sure that we're using the same word and understand what we're talking about. What does it mean to recover? What is recovery? Does recovery after surgery mean just to be pain-free? Okay, I had my joint done and it doesn't hurt anymore, but I still can't do what I want to do. Well, that's not really a goal that most people have. Is it to return to the preoperative baseline function, meaning you recover from the surgery, but you're just as good as you were before the surgery? Well, it seems like you had the surgery because you wanted to be better than you were before the surgery. Is it to be able to perform the minimal activities, meaning get around your home, go to church, come back with minimal or no pain or disability? I think that's getting closer. I think some people would be happy with that. But again, that's kind of just the bare minimum, okay? You know, I think there's more to be gained. Or is it to gain above preoperative baseline function, meaning to be better than you were before surgery, to a new higher level activity, to do things that you couldn't do before or maybe haven't done in years? You know, for me, I would choose D. If you ask me, how do I want to recover from a joint replacement? I would say D every time. And I think that's important to define and to state when you are being evaluated for joint pain or a possible surgical intervention. Let them know, hey, this is what my goals are. This is what I want to do. Okay, so now we've defined what recovery is. Let's talk about where are we now? If you walked into a doctor's office and you said, all right, what can I expect after surgery? What is the normal recovery curve? This is what it looks like. So I'll try and be as evidence-based as I can throughout this talk here, meaning, you know, I'll use literature, things that have been found recently about joint arthroplasty. So this was an awesome study out of the University of Utah, a great institution for joint replacement. They do thousands of joint replacements every year. And they just looked at 1,000 patients and they asked them, how were you before surgery? Rate your knee on 0 to 100. Okay, now let me ask you again, at 1 month, 3 months, 6 months, and 12 months. And how do those people recover? How do they feel like they're moving along? And what they found, as you can look at this graph on the right here, is that the steepness of that curve, it's really steep from the preoperative to 1 month. So people dramatically improved in that first month, but they were still only at a 60%, just above 60%. If we move all the way out to 6 months, you see they're only 80% recovered. And then finally, at a year, they got their maximal recovery. You see that curve start to flatten off. So this shows us that right now, our recovery generally takes about a year. People continue to see up to 20% improvement after 6 months. And so this is just, what are our expectations? What do we want out of this knee? You know, how do we compress this curve? How do we get it where we can recover as fast as possible and maybe get to that 12-month recovery area even sooner? So this is where we are now. But again, I think most people want more. So this is a metaphor I use a lot in clinic. Elena's probably heard me say this 1,000 times. My goal for everyone is to be a jetliner. So if you look at this curve on the right, you have the takeoff and then a cruising altitude. This is what we found generally leads to good outcomes. But most of us want to be like the rocket. We want to shoot up to 100%. But unfortunately, when you're that rocket isn't able to sustain the flight and it comes back down. So it's not a sustainable way to recover. And so that's where the rub is. How do we get you those same results and be like the jetliner, but without the crash like the rocket has? So this is what most people say. Well, they say, all right, that's great, doc, but I want it all. I want to be recovered. I want to be everything to be good, and I want it now. So So how do we do better? And that's what hopefully as we go through the talk tonight, you'll get some ideas of how we are doing better and how we're pushing those boundaries to help patient recovery. So the first thing is, let's start before surgery. What can we do before we have the surgery to prepare for after the surgery and that recovery process? So the first thing, it's easy, but it's also one of the hardest things. It's nutrition. So interestingly enough, multiple studies have found that we're consistently malnourished as a population. And 10 to 40% of patients undergoing orthopedic surgery, so just in general, someone that walks into a doctor's office and says, hey, I need an operation on my arms or legs, about 10 to 40% of them are malnourished. That's a really high amount. And what they've found is that people who are malnourished have increased risks of complications. So again, as we're trying to compress that recovery curve, these are the roadblocks that we're going to hit. People are going to have increased risk of infection if they're malnourished. They're going to have longer hospital stays, meaning you go home and instead of going home the same day or the next day, it might take you 2 or 3 days to go home. There's a higher risk of you needing to come back because you go home and maybe you're not able to thrive or you have other medical issues that push you back into the hospital. You're more likely to need blood after surgery. Most knee arthroplasties have minimal to no blood loss, but if you're malnourished, you're at higher risk of needing a transfusion. And then there's higher risk of organ damage after surgery. It's a stress on our body, and if our body's already stressed from malnourishment, well, again, it can't cope with the increased stress needed to recover from surgery. So what can we do? If almost half of us are malnourished when we undergo surgery, well, what can we do? What should we do? The first thing is we need to ask, am I malnourished? You know, if this is a problem, the first question is to recognize it and say, is my doctor screening for this? Are we assessing for these things that we can change before surgery to give me a better, quicker recovery? And then once we have that information, what do we do with it? What are the levels that your doctor is going to ask you to either obtain? What are the referral options out there? You know, at our group, we have an amazing nutrition clinic where you can go and get counseling. You can have someone help you with a nutrition plan. And then there's also protein supplement options. I think if you're found to be malnourished or at risk, that's something that you have to address. So this is, you know, there's multiple supplements out there. This is just one that I've vetted and is used routinely by my patients preoperatively if they're at risk of malnutrition. But again, if you don't ask the question, you're not going to know if you're at risk for this. So what else can we do to optimize ourselves? So again, multiple studies over the last 30, 40 years have looked at what risk factors lead to a longer recovery curve, more complications, inability to get to activity level that you want. And there's numerous, but here are kind of 3 big ones that routinely come up in studies. One is a high BMI. Another one, meaning increased weight. Another one is smoking. We know that smoking leads to inability to heal wounds. We know it leads to decreased pulmonary function, which can make it difficult after surgery to recover. And then finally, diabetes, specifically uncontrolled diabetes, meaning high blood sugars that are difficult to bring down. That can predispose you, again, to wound healing issues, infections. These are all things that if we find out before surgery, well, we can optimize you, make you the best version of yourself to recover quicker from that surgery. But again, if no one's asking these questions or thinking of these things, well, then you're not going to have the opportunity to address them. So I think the most important thing is just to talk with your doctor and ask, are we looking for these things? And again, I think a good arthroplasty practice or clinic should have either a department or a physician or someone aimed at optimizing these patients or optimizing you to ensure that you have the best outcome possible. All right, so we move on. So we're optimized. We've assumed we've gone to the doctor. They've told us we have maybe a few problems, a little protein deficient. We quit smoking. Our diabetes is under control. We're ready for surgery. You know, again, I think an easy metaphor for us to understand is the Kansas City Chiefs. I think everybody probably knows Patrick Mahomes and Travis Kelce. Their job doesn't start day 1 of the season. They've been in the weight room. They've had the summer workouts. They've had the spring training. And so that's really what we want you as a patient to have, that mentality is, okay, game day is my surgery, but everything leading up to that is really where I put in the work, or my physician has put in the work to make sure that I'm ready to compress that recovery curve as much as possible. So now let's move on to the surgery, or the immediate few days before and after the surgery. So the first thing I think you should ask when you're talking with your surgeon or deciding, is this the person that I'm going to use, is this person the best person for the job? Again, go back to that used car lot. We've all seen cars driving down the road and we said, that's probably not a car I want to buy. Same thing with our physicians. Doesn't matter who we see. So I think this is a really cool study, a recent study out of the Journal of Arthroplasty that looked at, does the training of your physician matter? Does their experience matter? Does the volume? How many knees do they do every year? Does that matter to me, to my outcomes? And what they found is it does. Surgeons that do more knee surgeries tend to have better outcomes. Patients get to go home faster. They have less things afterwards that slow that recovery curve down. Surgeons that don't do as many usually had patients that struggled after surgery or had issues reaching that top of that curve that they want. So in general, you do want a surgeon that does these frequently and does them at a high level frequently. I think intuitively that makes sense. And then the next question you should ask yourself is, do I need someone that specializes in this? Orthopedics has multiple subspecialties. We have people that specialize in hands, people that specialize in shoulders, people that specialize in feet, backs, pediatrics, oncology. So does it matter if you see somebody that specializes in hip or knee? And again, I think this is a reasonable question to ask. And the answer is there is a difference. People that have subspecialty training, that have seen complex cases and specialize in hard cases, well, they tend to have shorter operative times, meaning the surgery goes smoother. They're more likely to be able to go home after the surgery rather than needing additional help. And patients tend to rate their outcomes as better too. So I think overall you can say yes. Again, intuitively it makes sense. Should I choose someone that does this and is an expert in it? Well, I think yes. And then does it matter how they do the surgery? Is a knee replacement a knee replacement is a knee replacement? I don't think so. I think there is a difference in the way that people do knee replacements, and there are technical differences too. Specifically, one of the things that I've focused on and that I studied extensively in my fellowship is how we approach the knee. We have our incision or that, scar that you see on the front of your knee or your friend's knees, but underneath that, how they actually get into the knee joint is very important. The two most common ways, as you can see on the right of the screen here, is one where you actually cut the tendon. You go right down the middle of it, separate it, and move your kneecap to the side. It's an accepted way. It's been around for a long time, but I think is that the right way? Is that the best way? I think that's a question we have to ask. The other way, the way that I've trained and adapted throughout my practice, is something called the subvastus, where we actually spare the tendon. It's more technical, requires a little bit more expertise, but we actually move the tendon and muscle out of the way to access the knee joint. And so does that matter? Should I be spending time doing that? Well, studies have shown that patients with this actually had better pain. You're not going through the tendon, you're not damaging the muscle, so they had lower pain. They also weren't as stiff. Again, less trauma, less scar tissue, less stiffness. That makes sense. They had earlier return of quadriceps. Your quadriceps is your thigh muscle. Again, if we're being gentle with it, moving out of the way, it makes sense that it could get stronger sooner. Again, how do we compress the curve? We're continuing looking for ways to make that recovery time shorter. And then also earlier achievement of range of motion. One of the biggest things that we're working on in that first 6 weeks where you saw that really big jump up in the recovery curve is range of motion, getting that knee moving again. And if we don't damage the tendon, well, that could lead to an easier ability to get that range of motion back, meaning the ability to bend the knee like you want it to. There's also an earlier achievement of being able to straighten your leg so you can bend and straighten. These are the things you need to walk to get around. Again, the things that people rate as important to them. And then finally, improvement of the ability of the knee alignment as you flex and bend it. So again, overall, I would say yes, I think it does matter. And again, that does intuitively make sense to me that, okay, if we can do something in a less traumatic way or a more muscle and tendon preserving way, it makes sense that it could lead to better outcomes. So, all right, so we've talked about before surgery, we've talked about during the surgery, surgeon factors, things that they can do during surgery. Now let's talk about what can we do after surgery. Are there ways, again, that we can take that recovery curve, smush it, and get us to that 80, 100% level sooner than 6 months or a year? So, unfortunately, a knee surgery is a marathon run in reverse. What do I mean by that? Well, when you start a marathon, that first mile is the easiest. You're fresh, you're feeling good. Marathon gets harder as you go and harder and harder. And it's the last mile where people hit the quote unquote wall or are unable to keep going. With a knee surgery, it's the opposite. You do the surgery, and the first couple weeks are the hardest. That's when you probably had friends that say, I can't believe I did this. My knee hurts so much. I can't sleep, pain, swelling, all that kind of stuff. And then it gradually gets better and better and better. Remember that the jetliner, you take off and you get higher and higher and higher. So a marathon run in reverse is what our recovery is like. So why is that first couple weeks so painful? Well, it's inflammation, inflammation, inflammation. Our body's natural response to trauma, whether it's falling down and scraping our knee, breaking a bone, or surgery, is for inflammation. Inflammation is redness, swelling, warmth, pain. It's how our body heals. And again, that's the thing that we're trying to utilize to our advantage to allow us to heal from the knee surgery, get what we need to out of it, and then advance and recover. Again, recover above preoperative baseline. So inflammation, inflammation, inflammation is what we're really talking about during those weeks after surgery. So one of the most powerful ways that we've come up with it is anti-inflammatories. Again, anti-inflammatory in the name. We're able to take that inflammation down to an acceptable level to get us to where we want to be. Steroids. One of the things that's come up really over the last decade or so is new ways to use steroids. Putting patients on steroids during and after surgery to fight that initial inflammatory response because we know we need you to recover to get to that level that you want. And then cold therapy. Cold, we've all had that instinct of, I twisted my ankle, I hurt my shoulder, I'm going to put an ice pack on it. That helps to decrease the swelling, which is a sign of inflammation. It's low risk, it's easy, it's cheap. As you see, some people are unable to take anti-inflammatories or steroids due to medical conditions, but cold therapy, cryotherapy, cooling therapy, all these things refer to the same thing. Again, calming that inflammatory cascade through ice. It's nature's anti-inflammatory. I didn't come up with that, but I think that's an awesome way to look at it. And then finally, edema control. Again, one of the big processes that happens is inflammation is our body sends fluid there that can create pain, stiffness. It can spread down the leg. And it's always easier to prevent things, easier to prevent inflammation, easier to prevent pain than try and catch up on the other end. Again, if we're trying to compress the curve to a point where we get up to cruising altitude quicker, we got to be more proactive than reactive. So I think that's a good mantra to have. So let's talk a little bit about future treatments. What are things that are coming down the pipe? These are things that I've either just incorporated into my practice, things I've seen on the horizon that if I was a patient, I would want to be on the lookout for, or maybe ask my physician, hey, is this here yet? Is it still coming? Is there anything new that I should be aware of? The first thing is a new medication. It's not a new medication. It's a new use for a medication. The medication is called tranexamic acid. We refer to it as TXA for the initials. What we found out recently is this medication, which was originally used to treat, to stop bleeding, post-menstrual bleeding or bleeding during surgery, actually has other positive benefits on the patient. There's a great study, actually an award-winning study that you can see here in the top right. It's the AAHKS or AHKS is the largest national meeting of all hip and knee surgeons in the US. It's internationally attended by other societies. And this actually won their top clinical research award 2 years ago. And it was the effect of using TXA or tranexamic acid in total knee arthroplasty. What they found was that when they gave patients this drug for a few days after surgery, again, originally intended to prevent bleeding, but they found that it actually improved knee flexion. So at 6 weeks, again, compressing that curve, those first few weeks, they found patients actually had more flexion, almost 10 degrees more. That's significant. They also found that patients reported lower pain at 2 weeks and 6 weeks post-op. Again, those early periods where we're trying to get you moving. And then patients reported that they felt better, patient-reported outcomes. Now, this drug, just to get in a little bit of the nerdy details for you, it's a drug that helps to prevent the degradation of blood clots. So it stops the bleeding around the surgical site or whatever it's being used for, and helps to stabilize that clot. But they found through that, again, better range of motion, lower pain, better reported outcomes. So I think a really cool use for a drug that's already safe and being used, but could start to spread in the arthroplasty world. The other thing, we've all probably heard of it, artificial intelligence, monitoring at home, all these activity tracker apps, the Fitbits, the Whoops, the smartphone apps to track your sleep. This is something that's being incorporated. It's still in the early stages, but being incorporated in the arthroplasty recovery world. Again, how do we get more information to figure out how to tailor that recovery plan to you? Not only to help to hopefully intervene sooner, but again, figure out what's the best method to get you where do you want to go. So currently, there's real-time monitoring through smartphones, through devices like Fitbits or other ones. This one on the screen here is one that just has patches that you stick like a Band-Aid above and below the knee, reports steps, range of motion, and then patients can also report other things like pain or how they rate their knee. And so again, early studies, but they've shown patients tend to do well with this. Patients feel better overall. They feel like their gait is improving. They rate that they have better function of the knee due to maybe being able to intervene more quickly and more precisely. Patients feel like they have less pain and overall like they're mobilizing better. So I think this is something that's really cool. I think you'll probably see more of this in the future in different forms, maybe through apps or through actual devices that your surgeon uses on you to help you recover throughout your surgery. So, overall, recovery is a journey. Like we talked about on that first curve, remember it went all the way out to a year before we got to that plateau. So we're continually trying to push those boundaries to make it smaller and smaller to get you higher, but it's still a journey. It's a marathon. So we need to focus on the things that we can help in that recovery process. Number one, remember that preoperative optimization, making yourself the Patrick Mahomes and Travis Kelce to get you ready for that Super Bowl season. What do you have to do to prepare? Nutrition. Make sure that your diabetes or any medical issues you have are as controlled as possible. Make sure if your physician is optimizing, you ask them, hey, how can I be a better surgical candidate to make sure I don't have any issues after surgery? And then choose your team based on your needs. If you know that you have something that's a little more complex or there's something that you want out of your surgery, well, don't treat it like a used car lot. Again, go to the person that you think is right. If it doesn't fit, we'll go to someone else. Ask those tough questions of the person to really get an idea. Hey, is this the car I want to drive off the lot with? Ask about post-operative inflammation control. Remember, inflammation is the thing that we're fighting throughout that recovery curve. Make sure they have a plan for you. Ask if you can customize the plan, what things you can do. Do you already have swelling? Do you have issues with anti-inflammatories? Can you not take steroids? Have you had issues with stiffness in the past? All these things can help you to really maximize that curve. And then don't be afraid to ask about new treatments or recovery methods. Don't be afraid to ask them, hey, what's something new that's come up? Is there something worth trying? A lot of people are talking about new treatments that we have annual meetings every year where people bring up new ideas. So it's always good just to make sure, hey, am I doing the latest and greatest, or is there something else that we can be incorporating? So again, I think to go over it, this is what I would hope for everyone, how everyone treats their patients, but we want to provide a comprehensive, holistic pre-op, post-op, medical problems, everything, optimization. We want to provide a comprehensive, holistic care to patients suffering from hip and knee joint disease to restore their mobility and help them achieve their lifestyle goals. Again, how do we define recovery? For me, it's not just getting back to pain-free. It's, okay, how can we get you above to where you want to be? All right. Thank you, everyone, for listening. Okay. Any questions, comments, anything else that I can address?
If you have a question, you can either put it in the chat or just unmute yourself and ask.
I must have done a really good job then. I appreciate it. No, I think the most common questions I get about post-operative recovery is, it's the comparison. It's, well, how do I get to where my friend was? How do I get to this sporting event? And so I'd really just encourage everyone to make sure you're on the same page, as your physician. Again, ask about the optimization, ask about the customization. But that's the questions I get the most is, how do I get to that compressed curve? And I really think it's that continual process of making sure you're on the right team, have someone who's trained and subspecialized.
If you're already on a blood thinner, can this TXA still be used?
That's a great question. It can still be. There are a few contraindications to it, but it is okay to take on blood thinners, or if you've had a history of a stroke or things like that, still okay to take.
Okay. And yeah, my husband's needed a knee surgery replacement for years. He saw Dr. Newton for the Synvisc for several injections
until the pandemic
and then
hit.
then the pandemic hit and he just never restarted it. But his has already been deemed bone on bone. His records and film is there at where you're at the orthopedic group.
Oh, awesome. Well,
so would he need a referral from his PCP?
So if you want to call this number here on the screen, this is my personal secretary. She'd be happy to work with you. Overall, we can help to manage that kind of thing if you've already been seen by Dr. Newton. But good question.
Okay.
Yeah,
okay.
I asked my doctor if he thought I was healthy enough for a knee replacement, and he said yes, I should have no problem with it.
Oh, perfect. No, we're happy to see. I always like working with other physicians and making sure you're, like I said, as optimized as possible, but happy to help if we can.
Okay. All right. That sounds good. I know the only reason I talked him into seeing this is because I told him there was maybe a shorter downtime, and for his age, he's very active. So
that's awesome. No, I think that's the mentality to have. Again, we want to get you back to the things that you want to do. We want to get you back to doing the things that maybe you can't do, right?
Well, that's what I'd like to be able to do, is do what I used to do. Maybe not as much as I used to, but I still work and I still enjoy it.
There we go. No, I love that. That's a great attitude to have.
We enjoyed your presentation.
And we'll be trying to get an appointment with you just as soon as we can.
No problem at all. You can tell her, Alex is my secretary's name. Just let her know we talked tonight. I'm sure she can find a spot for you whenever you'd like.
All right. Thank you.
All right. Thank you very much.
Of course. Of course. All right. Any other questions or comments? If not, I'll start. Go ahead.
Is this a surgery where you go home the same day?
There are. If you're, I usually base that again on the patient, but in general, yes, this is a surgery you can go home the same day from.
Okay. Thank you.
Of course.
Doc, we have a question in the chat that says, do you do robotic surgery?
I do. I do both robotic and non-robotic surgery. I think that's one of the great new advancements over the last 15 years, has been robotic surgery. It was very popular at my training site. I think it can be advantageous in certain situations. But yes, it is something that I do and am familiar with. Wait just maybe a few more seconds. No, we're happy to talk with anyone. If anyone thinks of any other questions or concerns in the coming days, again, this is my secretary's number here for appointments with me. She'd be happy to relay messages to me and I can give you a call back or something like that. So if you think of something as soon as we get out or tomorrow, don't hesitate to call. We'd be happy to chat. But otherwise, I hope you all have a great evening and look forward to seeing you all around.
Thank you all for attending, and thank you, Dr. Niland. We really appreciate your time.
Awesome. Thank you so much. Have a great evening.